As I traveled across the state during the August recess, it was clear that North Carolinians are concerned about the rising cost of health care. In the past 10 years in my state, the cost of health care premiums have increased 98%, whereas wages have increased only 18%. That's a startling statistic. Just last week, the Chamber of Commerce from Dunn, North Carolina, came to visit me in Washington. One man has a company that employs 600 employees. The cost of his health care last year for his company increased 28% in 1 year. That is simply unsustainable for America's businesses. The Treasury Department issued a stern warning just last week. If we do nothing to tackle the skyrocketing cost of health care, nearly half of all Americans under the age of 65 will lose their health insurance in 10 years. Those are frightening numbers. Right now, the average family's health insurance is $13,375. If Congress does not send our president a reform bill, premiums are expected to rise to a staggering $25,000 in 2016. Today, this average premium represents a little over a quarter of a family's income. But by 2016, that average premium will represent almost half of a family's income. How are people going to afford to pay for mortgages and save for college tuition if they're paying half of their monthly income for insurance premiums? Mr. President, this past year, North Carolina's unemployment rate rose to 11%. Many of the thousands of North Carolinians who have lost their jobs in this recession have also lost their health care, and many more families are facing this frightening reality. One medical emergency could send them into bankruptcy. In 2005, nearly half of all the Americans who filed for bankruptcy cited major medical expenses as the reason for their financial decline. And between 2001 and 2008, the number of uninsured in North Carolina increased from 1.1 million to 1.4 million people. Without action, this number is going to continue to grow. The Senate Health, Education, Labor, and Pensions Committee crafted a bill that ensures that people who like their insurance and their doctors keep them. They also expand access to health insurance for those without it and slows down the skyrocketing cost of health care. Three critical components that President Obama called for in his speech to Congress 2 weeks ago. The President has been adamant that health care reform must not add one dime to our federal deficit now or in the future, which has been a requirement of mine all along. The exploding cost of health care has put our nation's economic security at risk. We simply cannot afford inaction any longer. In 1960, health care spending was 4.7% of GDP. Today, it's 18%. The trajectory by 2030 is looking at 28% of GDP. Mr. President, we need health care reform to get our deficit under control. We need a reform package that ensures a pre-existing condition, such as diabetes or cancer, no longer prevents anyone from obtaining health insurance. And we need health care reform to ensure America's families don't have to fear bankruptcy when a loved one gets sick. Thank you, Mr. President.